Hi, thanks for your interest in pediatric manual therapy. And what I'd like to share with you today is footage from a session with baby Lark, who's 6 weeks old, who came to visit me with her mom Kelly and older brother Truman. And baby Lark had a really a quick birth, relatively healthy birth. Everything progressed evenly, so there weren't a lot of complications. And what her mom is finding with her in these early weeks is that she, especially in the afternoon to evening, tends to get a little, almost a little colicky, a little sort of digestive distress, a little more prone to becoming irritated and a little harder to soothe. Her nursing is going fine, and once she does get to sleep, she sleeps just great. And we're going to see how cranial work can help her. And so through this session, you'll see me using several different contacts and kind of doing intermittent touch. Working with infants, it's pretty helpful to have to work a little bit on an area that needs some release and some support, and then let the baby kind of rest and let their system take that in and work with that. So this work is a little bit of a dance where we kind of come in gently, do some assessment, do a little work, and then we kind of come back out gently and let their bodies integrate that and take that in, so we don't overwhelm them, overtax their system. So with baby Lark, you'll see me working with her legs. So in her left knee, there was a little bit of restriction. Babies, newborns tend to have flexed knees anyway as part of their postural pattern, but when I assessed her leg and how it extended, her left knee didn't want to fully extend as a gesture. So my work with her leg was kind of helping the tissue in the back of the knee sort of stretch and lengthen and just kind of ease out a little bit. You'll see me working with her at the pace of her tissue, at the pace of her body, which with little ones, their tissue is so healthy, really nice and fluid and stretchy, and compared to us older grown-ups, babies are kind of a breeze to work with because their tissue is so healthy. And even so, they can get little stuck places. So working with Lark's tissue behind her knees, just engaging it and letting it stretch at its own time. You might imagine that babies don't put up with much discomfort, so the touch that I use needs to be gentle enough to be acceptable to her, her nervous system and how she feels. So as that restriction opened up in the back of the knee, I carried it down through the back of the calf, the front of the calf, inside and outside of that left leg, and finding at her feet some extension of that pattern into the foot and the arches of the foot. So working around the ankle and the heel into the arches, particularly the arch on the inside of the foot for Lark needed some support, some help. And she seemed to really take to that work pretty nicely. We wound up going back a couple of times to that area. And also for Lark, looking at the length and the support and freedom in her spine. So one of the techniques that's really fun to do with infants, because they're so small, is that I can cradle their torso and head and work with the body, work with the movement that the baby's generating, because they like to squirm and to move and to stretch, and every time she's moving her spine, there's the opportunity to stretch those tissues a little bit farther and help her system free itself. So you'll notice that I'm going with Lark's movement, but sort of accentuating as her body is leading the dance of opening up the tissue around the spine, and I think for her in front of the spine, where the organs are attached and the organs live. And this is a kind of series of releases that I find quite often with kids that have digestive distress, whether it's they're sort of gassy or colicky, or they get maybe they get sort of constipated, or their lower digestive tract is a little off. This sort of spinal unwinding tends to really help them with that. And another technique that you'll see me use is treating the length of the spine and the cranium with contact down low on her sacrum, on her pelvis. And that technique is really, it's a very, very gentle way to address tissues at a distance. It's something that this work comes out of an osteopathic framework, an osteopathic tradition. And one principle in osteopathic work is something called least force intervention. And what that means is I want to get an intervention, get a treatment, a change, but I'm going to do it in such a way that I'm using the least force possible. And by working that connection of the spine from the bottom, I get release all the way up the spinal canal, all the way up to the cranial base, and I can address changes in the skull and the cranium with a much gentler touch. Least force intervention is a way of making the work very gentle. And with infants, with newborns, they're not going to let you do much that's overly forceful, because they'll cry right away. They let you know right away what they like and what they don't like, which for me is part of the fun of the work. Their systems change very quickly. They're very responsive in giving the feedback. It means as a practitioner, I need to listen to their cues and watch their cues, right in the same way that mom is watching the cues. Mom and dad learn to watch the cues, and even Truman, at some point, her older brother, is learning to watch and listen for Lark's clues, for when she's okay and not okay. And for me, that's all part of the fun of this work. So I hope you can think about pediatric manual therapy as part of a treatment plan for your child. If they have signs of distress or you have concerns about them, this is a very gentle form of work that can really help them quite a bit as they are growing so much in those early years.